My name's Karen Thompson. I'm from Springdale, Arkansas, which is in the northwest corner of the state. I had had some various pains for several months and went to my general practitioner at home, and she ordered a CT scan, and I was diagnosed with a hepatocellular carcinoma, which is a big word, hard for me to say. It's a cancerous tumor that forms on the liver. I guess it's not exactly in the liver. The next week I went to an oncology clinic at home, and the doctor was very honest with me and said that my condition was out of his area of expertise. And at that first point he thought that my only option was a liver transplant. So he visited with us about where I needed to go and location and things like that. And he mentioned Barnes-Jewish, one of the first medical centers that he mentioned, and he said in his opinion it was probably the best. The instant that I crossed the threshold between the hotel connected with the med center and the CAM building, that I started feeling a sense of comfort just being here on campus, and it just got increasingly better each visit that we made. I visited with Dr. Chapman and his staff that first visit, and the sense of comfort got even better when he said, no, we're not going to do a liver transplant. You don't need it. We're going to just take that tumor out and go from there. So the prognosis is great. I basically can do what I feel like doing when I feel like doing it. And as Dr. Chapman explained to us, there's always the chance that the unfortunate disease of cancer can reoccur, but with the strong support of my family and friends and my faith in God, it's not going to come back. Everybody from that first initial MRI, the technician that put my IV in, to the technician that ran the MRI, everybody in this facility makes you think you're the only patient there, and you're the only person they care about at that time. And that's what patients need. It's phenomenal how nice and courteous and professional and helpful everyone is. And you always hope that nobody needs the services of a hospital or a clinic, but I thought I would never need it. And this late in my life, I have needed it, and again, I wouldn't want to be anywhere else. I've shared that story with my family, I've shared that story with coworkers, and so I know that has prompted my family to donate as well, because they know just through my experience how wonderful this place is. And again, if the foundation, from what I understand, is all about helping patients. There's different categories that you can determine what section you want your donation to go to, but the bottom line is every one of those sections that you can donate to helps the patient. And me being a patient, that's what it's all about. It's the patients. If you've got contributions that you want to make for tax purposes at the end of the year, this is the best place to do it, because not only does it make the donor feel good, but it helps so many people. It doesn't matter how large or how small the donation, every donation helps, and anything that anybody can donate will be useful in a lot of aspects. So give, give, give.